Hi, good day to you. How are you? This is Dr. Amihan, your humble servant in the northern part of Antique. Many of us received a complete or full dose of the novel vaccine, as vaccination continuously advocated by our healthcare professionals as a prevention for disease severity, hospitalization, and death for COVID-19. But still, there are fully vaccinated individuals succumb to the novel disease, despite they receive full or complete dose of the novel vaccine for COVID-19. And few real-world data that are reliable enough to show or describe breakthrough SARS-CoV-2 infections in persons who received full dose of the novel vaccine and considered fully vaccinated, especially with regards to the impact of vaccination on hospital admission to persons or people who are considered fully vaccinated. I will show you some data from the US. I am now showing to you a report which was published on November 1, 2021 in the Lancet Infectious Diseases journal, which is a very recent findings about hospitalization among vaccine breakthrough COVID-19 infections. Many of us receive a complete or full dose of the novel vaccine, and yet few real-world data that are reliable enough to show or describe breakthrough SARS-CoV-2 infections in persons who receive full dose of the novel vaccine or to those fully vaccinated individuals, especially the impact of vaccination on hospital admission. This is now the study that I am referring to. It involves 969 patients admitted with RT-PCR positive tests for COVID at Yale New Haven Health System between March 23 and July 1, 2021. These 969 patients who are COVID positive admitted in the hospital was classified according to their vaccination status. The first classification involves 797 unvaccinated patients admitted in the hospital. And the second classification involves 103 partially vaccinated with one dose of Moderna or Pfizer vaccines. And the third classification involves 54 patients were fully vaccinated, and some of the symptoms and some of the patients had symptoms 14 days after their completed vaccine course. And on the fourth group here involves 15 patients also completed the course of 2 doses of Pfizer or Moderna or 1 dose of J&J vaccine, but in these patients, the symptoms occurred within 14 days after their second dose. Okay? So, of these 54 patients who were fully vaccinated and had symptoms, and some of them had symptoms after 14 days of their completed vaccine course, are also grouped based from the disease severity. So, Group A, composed of 25 patients, which is 46%, were asymptomatic and admitted due to other diseases, not related to COVID, but incidentally turned out being RT-PCR positive, since it is the ruling of the hospital or protocol of the hospital that before they admit the patient, they should be tested first with RT-PCR before being wheeled in to the hospitals. Now, of the 54 patients who are fully vaccinated with symptoms, in this group, four patients or 7% had mild symptoms. So they had fever, cough, throat itchiness, body pain, which is less symptoms of COVID. So they are considered mild. On Group C, out of the 54 patients, 11 patients or 20% had moderate disease. So meaning they had less respiratory disease. And the oxygen saturation here is more than 94%. Now, on this Group D, of the 54 patients who are fully vaccinated, 14 of them or 26% had severe or critical illness. Meaning, if they are severe, there is a lung infiltrates more than 50% with O2 saturation of less than 94%. Now, in critical illness, this patient had respiratory failure with septic shock and multiple organ failure. Now, of these 14 patients who are admitted with severe and critical illness, 4 patients or 7% were admitted in the ICU. Of the 4 patients admitted in the ICU, 1 patient was intubated and hooked on volume respirator or mechanical ventilation. And of the 4 patients who are admitted in the ICU, 3 patients died. 3 patients died. And of these 3 patients who died in the ICU, 65 to 84 years old age range, or these patients had an age range of 65 to 84 years old, so they are old, with being also overweight, with a BMI or body mass index more than 25 kilogram per meter squared. They also had 3 or 4 comorbidities combined, namely, some of them had cardiovascular disease, had diabetes mellitus type 2, had cancer, and lung disease. And I failed also to mention that there is one patient who took immunosuppressive agent in the form of steroids and immunomodulator for transplant rejection. Okay, so based from this result of the study, we can formulate that fully vaccinated patients with multiple comorbidities had a big chance of having severe or critical COVID that leads to higher chance of mortality or death. Second, fully vaccinated persons or patients who are younger of age without or with fewer comorbidities had lower chance to develop severe or critical COVID with a higher chance of survival from COVID-19. And number 3, fully vaccinated persons or patients in general has a lower possibility of having severe disease, reduced hospitalization, and decrease death or mortality according to this recent well peer-reviewed report. In my opinion, the presentation of this very reliable data gathered from the admitted patients at Yale New Haven Health System or Hospital from March 23, 2021 to July 1, 2021 is timely and true because this is what is really happening in the real world scenario, especially here in our place and also from other places in other parts of the world, that there is an upsurge of breakthrough infections among or from older patients or population with, especially with comorbidities. Just yesterday, somebody called me, a relative of the patient, if I can render a home visit medical checkup to an 82-year-old female with cough, fever, loss of appetite, difficulty of breathing, shortness of breath for almost 7 days. And when I arrived in their place, donned with my PPE, and immediately got the medical history of the patient, lo and behold, she was fully vaccinated 5 months ago. And after my physical examination, I advised her for admission in the hospital, but she refused and she opted for a home admission. Thus, I don't have any choice but to give her a proper medical management. And after that, I went home. But before I forgot, her respiratory rate is around 32 cycles per minute. The cardiac rate is 180 beats per minute with a BP of 140/100. She was also febrile with an auto-SAP of 87% at room air. I hope that with God's help, together with my medical management, will save her life. So once again, this is Dr. Amihan, your humble servant in health in the northern part of Antique. Greeting you all good day and wishing you all the best of everything. Thank you and Godspeed.